After being consumed by a political crisis, Myanmar is facing a rapid rise in COVID-19 infections amid a shortage of oxygen supplies. And this spiralling virus count has struck the trial of ousted leader Aung San Suu Kyi, who was deposed in February of this year. A witness for the prosecution has failed to testify after becoming infected with COVID-19. However, a second witness did give testimony on the charges that Aung San Suu Kyi flouted virus restrictions during last year's elections. The court also heard evidence on separate charges that accuse Aung San Suu Kyi of illegally importing and possessing walkie-talkies. The ousted Myanmar leader and all her staff members have been fully vaccinated while they're in military custody. She faces a raft of charges that could see her jailed for more than a decade. During a pre-trial meeting today, the ousted leader voiced her grave concern for the people during a third wave of COVID-19. This as the COVID caseload is suddenly on the rise and Myanmar is struggling to secure enough oxygen supplies for its residents. Photos and news stories have emerged showing people lining up to buy oxygen in the city of Kalai in the northwestern region. Residents of Myanmar's two largest cities, Yangon and Mandalay, are also having trouble finding oxygen supplies. Recently, a video emerged on social media from the city of Mandalay showing dozens of people desperately grabbing free face masks, which were being distributed in the city. One image of Myanmar's creaking healthcare realities. One of the world's weakest healthcare systems is on its knees, unable to respond to a spike in cases and disruption following the coup. The military seized power in February this year, just a week after the first vaccinations were given to health workers. After the armed forces seized control of the nation, doctors led what they called a civil disobedience movement to protest the takeover. Since then, the military has attacked, arrested and even killed doctors and other medical professionals. The World Health Organization has documented over 240 attacks on healthcare professionals in Myanmar, leading to dozens of injuries. A watchdog group called Insecurity Insight has counted at least 12 deaths of healthcare professionals. Myanmar's new leader, Senior General Min Aung Hlaing, has ordered oxygen plants to work at full capacity. Industrial oxygen suppliers have been instructed to meet the needs of patients. The government has dropped all duties and licensing requirements for the importation of oxygen concentrators and devices that generate oxygen. The Health Ministry of Myanmar has reported a record of over 4,000 new cases, making the total infection count rise above 180,000. And 71 deaths have been recorded in the last 24 hours, bringing the total death toll in the country to over 3,700. The number of tested people found to be infected is hovering around 25%, and the numbers are rising at an alarming rate. Data on vaccinations is not very clear in Myanmar. However, it appears that as of last month, only 3.5 million doses had been administered to the country's 55 million people, which means a maximum of 3.2% of the population may be fully vaccinated with 2 doses. According to the aid group Relief International, Myanmar's major challenges are a lack of adequate screening, testing capacity and the availability of vaccines.